This webinar is actually brought to you by Dalfran Pharmaceuticals, and we thank them for their support during this Reproductive Health Month. Hi, Claire.
Hello, how are you?
Fine, thanks, and you?
I'm well, thanks.
Okay, let me introduce you without any further ado. As you can see, Claire's here. She's a registered dietitian and co-founder of Nutrition Solutions, one of the largest dietetics practices in South Africa. She regularly presents nutrition educational content to health professionals both locally and internationally, and is considered a key opinion leader in polycystic ovarian syndrome and obesity medical nutrition therapy management. She recently developed the PCOS BOSS program to support women with this condition and change their health in a sustainable way. Thank you for joining us, Claire, and over to you.
Thanks so much, Saskia. I'm going to share my screen. I've got a few little slides over here that I'm going to just share. So there.
Perfect.
Okay, so I decided to really focus in on a few key areas when it comes to PCOS and nutrition and changes that you can make. And I also decided to look at key aspects. So we're going to look at insulin resistance, inflammation, how you can change your diet to down-regulate inflammation because it has an effect on insulin, on hormones, on egg quality. We're also going to look at omega-3 fatty acid, inositols, and vitamin D. So I've chosen some key aspects because we could chat about nutrition and PCOS for days. It's my favorite topic to talk about. But the first thing I want to just explain to you is when in a lot of women with PCOS, we see high insulin levels, we see hyperinsulinemia. It's also very common in women in general who are carrying additional weight. And what the side effects are when we see this hyperinsulinemia is we know that the sex hormone binding globulins go down. And when they then decrease because the insulin is higher, we see increases in testosterone, in androgens, and that then has an impact on acne, on anovulation, on hirsutism, the hair growth in the central midline, and infertility. There are also other issues with the hyperinsulinemia in terms of cardiovascular risk goes up, our CRP goes up, which is a marker of inflammation, it's C-reactive protein. So this is something that's really important if you are on a fertility journey, but also in general for PCOS to manage it better. Now, many of us sort of fall into the category where our diets can become pro-inflammatory. And we're also seeing that among the pro-inflammatory dietary guidelines is particular concern around high energy diets with high content of complex carbohydrates that are low in fiber, they're high glycemic index. Think your pizzas and your pastas and your takeaway foods, and it's this westernized diet. And what we're seeing is we're getting super physiological postprandial spikes in glucose and lipids, and this is then resulting in a pro-inflammatory state. And this can happen even if you don't have PCOS, even if you're sitting watching and you go, okay, we're trying to have a baby and our diet's really not great at the moment. We're having takeaways all the time. And I mean, I'm seeing that often in patients. I had a patient today where they're having takeaways about 9 times a week. And that's going to definitely have an impact on insulin, on CRPs and inflammatory markers. So we actually know that unhealthy diets are, these patterns of unhealthy diets are actually activating our immune system and causing this low-grade systemic inflammation. And a really amazing paper that I quite enjoy, it was by Patel, and they said the rescue from PCOS lies in the adoption of a lifestyle that discourages oxidative stress, and it really supports immune, like away from that low-grade inflammation. Now you might say, well, Claire, how do I know if I've got inflammation? What are the things that are causing that for me? And we can actually measure inflammation. We can test your CRP, which is a C-reactive protein. We often would look at an ultra-sensitive marker, and we want that to be less than 1 is the ideal number over there. And also sometimes we see elevations in ferritin, which is another inflammatory cytokine that goes up when there's high inflammation. Now, the things that you could be doing in your day-to-day lifestyle that are impacting inflammation are if you're physically inactive. So if you're sitting for more than 6 hours a day, you're not moving, you're increasing risk for that systemic chronic inflammation. Obesity also drives this, and as Professor Kruger mentioned earlier, what's quite encouraging is even a small amount of weight loss, so if between sort of 10 to 15%, can really make significant improvements on your CRP, on things like insulin resistance, etc. Gut dysbiosis is also a big cause of more chronic inflammation. If we're not getting adequate fiber in the diet, adequate vegetables, if we're not walking enough and we're not having regular bowel movements because our gut function's not great, that also contributes to inflammation, because inflammation is actually down-regulated if the gut function is good. Our diet's really important, and I'm going to show you which foods sort of contribute more to inflammation or down-regulate inflammation. We also know that isolation and chronic stress and disturbed sleep are all factors that are contributing to that systemic chronic inflammation. Now, certain foods will down-regulate inflammation. So things like fruit and vegetables and like turmeric and ginger and garlic and vitamin E and monounsaturated fats. Think lots of colors, fresh fish, legumes, soluble fibers, more Mediterranean diet, where trans fats, saturated fats, very energy-dense, nutrient-poor foods will actually increase inflammation. So we want to use more of the foods that are down-regulating inflammation. I mentioned gut dysbiosis, and in this picture you can see, if we've got a fiber-deficient diet, we're actually causing higher inflammatory responses. And if the diet's high in fiber, and it's important to note that you're not going to reach fiber intake from vegetables alone, you do need to add high fiber, good quality carbohydrates. How to identify these foods is check the label, make sure that the foods have more than 6 grams of fiber per 100 grams. The higher you can go, the better it's going to be. And how that mechanism actually works is when the fiber in your diet is adequate and it's high, you can produce short-chain fatty acids like acetates, propionates, and butyrate. Now, acetates in particular will down-regulate inflammation. So your gut health and gut function is an important lifestyle change that you can make to optimize your health and improve fertility as well. Now, omega-3 is a really important one, and often people don't eat enough omega-3s in their diet. You would need to eat 3 servings of omega-3 fatty fish per week. That's things like sardines and pilchards and mackerel and salmon and trout. And most of us don't get those foods in, and sometimes the fatty fish like the salmons and the trout can be quite expensive. So we often recommend that patients even use the salmon sachets and make fish cakes, or do the pilchards and the sardines. They're just a more cost-effective option. So finding solutions that are more manageable, but there's actually clinical trials where they gave omega-3 supplementation together with vitamin D over a 12-week period and showed that this reduced testosterone levels, improved mental health parameters, and decreased that CRP inflammatory marker, as well as reduced interleukin-1, which is another inflammatory marker. Now, we know that when we gave omega-3s, it also significantly improved lipid profile, decreased waist circumference, and reduced the intervals in between periods. So it actually helps to shorten that menstrual cycle when we're getting ladies who often, when they come to me, they're not having menstrual cycles at all. And we slowly get their menstrual cycle to come back. But initially, it starts with these longer cycles, a 60-day, then a 40-day, then back to a 60, then a 40, then a 28, then a 56. And so the cycle starts improving the length. And we often do that with Inositol therapy, but the omega-3s are also used. Very important, if you're using an omega-3, it must be DHA and EPA. So when you look at the back of the bottle, make sure that you're buying an EPA DHA, not an ALA. So not flaxseed or krill-based omega-3s. You really more want to go for salmon-based or algae-based, and the DHA and the EPA will be your guide at the back of the bottle to help you choose a better option. Obviously, food intake is a great way to do it as well. And we know that these fatty fish reduce inflammation, they improve insulin resistance, and also a bonus is they reduce triglyceride levels, which are often also another sign of dyslipidemia that we see in women with PCOS who have high insulin or insulin resistance. Vitamin D is absolutely critical in the fertility journey, and sometimes it gets overlooked, and patients aren't aware that it's something you should look at. Vitamin D actually acts as an anti-inflammatory in women with PCOS, and you get these ROS species, which is your reactive oxygen species. Now, they're caused by inflammation, oxidative stress in the body, and these vitamin D actually bind these ROS, like little bad Pac-Mans basically. But we see that vitamin D can actually help to reduce these end stage, we call them advanced glycation end products, get reduced by having optimized vitamin D. And there's quite different sort of views on the vitamin D. We know that if the vitamin D is low, it actually affects the expression of the insulin receptor, the insulin synthesis, secretion of insulin, the insulin sensitivity, and it decreases the production of pro-inflammatory cytokines. So we want the vitamin D to really be quite optimized, and just having a vitamin D at like an average of 20 is really for postmenopausal women to not get osteoporosis. In women with PCOS, especially on the fertility journey, we really try and increase those levels to above 60, which is what I often look for in my patients. And we go on higher dosage of the vitamin D, but we're monitoring those patients. So we're not just putting them on the high doses and leaving them. What we do know is that vitamin D is involved in several features of PCOS, including infertility, hirsutism, insulin resistance, and we even know that normal ovulation is associated with higher levels of vitamin D. And vitamin D is also associated, if there's a deficiency, with lower rates of follicle development and pregnancy after stimulation. Vitamin D supplementation may also improve the reproduction function of women in PCOS by restoring the menstrual cycle. So there's a lot that vitamin D can help with, and it's something that we should absolutely make sure we're getting enough of in our diet, and if we're not, we have to supplement with that one. Then inositols. Inositols are a type of B vitamin, actually. There are 9 different types of inositols, but the ones that are most abundant is actually the myo-inositol and the D-chiroinositol. Now, there are many publications around inositols and different studies that have been done. Here is an example of an observational study where they had 3,602 infertile women with PCOS, and they did inositol therapy on these women and restored 70% of ovulation in the study, with 545 pregnancies were obtained. And, you know, they actually got similar outcomes to the metformin trials. Now, what's quite interesting when you're using inositol is the dosage of inositol, and the ratio of inositol is really important. You want to make sure that you're getting 4,000 milligrams of myo-inositol with 1,000 milligrams of D-chiro, or not 1,000, 100 milligrams of D-chiroinositol. This is a 40-to-1 ratio, and that ratio is important because if you're not using the correct ratio, especially in fertility, women with PCOS you can convert myo-inositol to D-chiroinositol. But the clinical studies and the systematic reviews, I've just read another one that was published now in 2024, are showing that if we use the myo-inositol alone, we can overconvert to D-chiroinositol, and it can actually affect the ratio and have a paradox effect and actually have a negative impact on fertility. So it's really important to get the right dosages, the right quantities, and the right ratio when using inositol therapies. So it's really important that you check that when you are choosing a supplement for inositol therapy. And we normally, if in women that are supplementing with inositols, it takes about 6 months. We say at least 6 months of therapy, of daily usage of inositol to get the outcomes. That's what we see in the clinical trials, as they say, about 24 weeks. But sometimes women will say, I used inositol, didn't really work. And then when I check with them, they didn't really have the right dosage, the ratios weren't correct, or they stopped taking it after 2 months or 3 months. That didn't really work, but they haven't actually used that therapy for the amount of time that is recommended in clinical trials. So my key sort of guidance to those of you that try and improve your lifestyle and your health around your PCOS, around your fertility journey, is you want to get inflammation down. You want to diet high in fiber to do that, high in omega-3 fatty acids, high in vegetables. You want to try and include about 4 cups of vegetables a day. And I sort of get these blank stares from patients when I say that, because you're like, how am I going to get that right? You're not going to get it at meal times only. You've actually got to start So I say sprinkle the vegetables throughout the day and increase vegetable intake. It's also important to have adequate protein in your diet, but good quality, lots more fish, lots more legumes, a little bit less red meat and chicken as well. So you want to have good combinations of lean proteins, lots of vegetables, high fiber, reading those labels and getting as high as more than 6 grams per 100 grams, but the higher the better. So it's just sort of key takeaways for this evening, and I hope that helps you. And yeah, Saskia, I'm ready to take any questions.
Thank you, Claire. That was great. I love that. And the Inositol therapies, is it so it's easier to take the sachets that already have the right ratios?
Yeah, you definitely want to look at getting the correct ratios, because what you sometimes see is people might take like 1,000 milligram inositol supplement, and the thing is the structure of the inositol is very similar to glucose. So what happens is it's going to compete for absorption. So it's also better to take inositols away from food. Possibly it's a better option, but you definitely want the right ratio. So just to recap on that, it's a 4,000 milligram myoinositol with 100 milligrams of D-chiroinositol will give you that 40:1 ratio. And we're just seeing more and more literature coming through to support that ratio and the outcomes being more supported, I guess, in those amounts, yeah.
And it's interesting that you say you have to allow the 6 months. So not just to think it's going to be instant, or like the men, their sperm can improve in 3 months. We need to be more patient.
But I must say, you often start seeing great changes already. If when I have patients that are doing inositol therapies and their omegas and they've started exercising and their sleep is better, we see the return of the cycles sooner than 6 months. But you know, if you on this journey and you're not necessarily seeing someone that's guiding you through the process and you want to try to do some things on your own already, you've got to give it time. And the hard thing, I think, Saskia, with the habits is when people see the dietitian, we're like, oh, we have to change this and we've got to change that. And you're not going to change it all at once. You know, that one few first consultations with the dietitian is really not I wish we were magicians and we could wave a magic wand, but we're not. So it takes a lot of like different adjustments to current habits and changing things over time, and it all comes together and it really does get better. So I just, yeah, you know, just when you're in that stage and you're in the fertility journey, it's really hard. And I just want to say to those of you that are listening is, you know, just I know that it's hard and we think of you, and just keep going and get the support that you need. And in the things that you can change, be really awesome with changing those things, because they do help. Those little changes have got an impact.
Thank you, Claire. And where can people get hold of you? What are your social media handles and your website?
So it's Dietitian Claire. So dietitian with the DIETITAAIN, and then Claire, and then Nutritional Solutions is our practice one. So it's Nutritional Solutions SA. So you can have a look for us there, and our practice is nutritionalsolutions.co.za. So we have branches in Cape Town, Pretoria, the South, and in Johannesburg. So all over, depending where you are.
Excellent. Thank you, Claire, and thank you for your time this evening. I really do appreciate it. This will be this webinar is recorded, so it's going to be made into a video, and we'll send that to you to post onto your socials and use accordingly for your clients as well. And for everyone watching, if you keep an eye on reproductivehealthmonth.com, those videos will be loaded of each of the webinars that we've had over the course of Reproductive Health Month. Thanks so much to Delfran. Take a look at their website. They've got some amazing products. Have a good evening, everyone.